I have seen a UFO. Don't believe me? Why don't you believe me? I'm an expert in this field. I have seen a UFO. You don't know what a UFO is? Unidentified flying object. I have seen an unidentified flying object and I believe that there are aliens. Why don't you believe me? Oh, it's just because one person is saying this. Then look at this. There are three people saying this. They have photographs also and they have published it also. Three people are saying that there are unidentified flying objects. You're still not believing me. Why not? So now we sent 1000 people to these places where people saw unidentified flying objects, and we also sent 1000 people to places where people have never seen unidentified flying objects, and we compared the two. Now will you believe me? Oh, you're saying it has nothing to do with causal link. There's no way to prove cause and effect. It's just observational. Alright. I sent 1000 people only to unidentified flying object detection zones. Some I randomly sent with detection equipment and some I randomly sent without detection equipment, and then I analyzed the feedback I received from them. Now will you believe me? You still don't believe me. Okay, I have analyzed all the high quality research on this topic and now I have come up with a conclusion. Everything that is high quality I have studied, all the studies I have studied, and now I have come up with a conclusion that yes, this requires further research. Will you believe me now? These are the levels of evidence. In simple terms, you have to go from anecdotal evidence, one person seeing it, to many people seeing it, to a proper study, to a randomized control study, and then an analysis of many randomized control studies. That's how you remember levels of evidence. Let's talk about them one by one. For the purpose of this discussion, we will use the Oxford Center for Evidence-Based Medicine, and we will stratify the levels of evidence in medical research under the following headings: 1A, 1B, 1C, 2A, 2B, 2C, 3A, 3B, 4, and 5. You might find other resources which stratify the levels of evidence in different ways, but this is, I feel, the most comprehensive stratification and also the easiest way to remember. The way to remember is remember the story of UFOs. First, we have to understand what is evidence-based medicine and why do we even need it. In our practice, sometimes we encounter a therapeutic question to which we don't have an answer. Sometimes we need to treat a disease to which we don't know the proper answer to how to treat the disease. So we need to search for the best quality evidence that exists on how to treat that condition. That is the best quality evidence. Alright, so best quality evidence needs to be searched. It needs to be critically appraised. Then the clinical experience of the doctor and the values of the patient should be combined. So best quality evidence, clinical experience of the doctor, and values of the patient should be combined before deciding what treatment should be administered to the patient. So you need to know what is the best quality of evidence. For that, you need to know the different levels of evidence. You can't blindly trust low quality evidence. That is not going to be good for you and nor for the patient. That's the rationale for remembering levels of evidence. The other rationale is you might be asked this question multiple times during your exam. It might be asked in your theory exam. It might be asked in a viva. In a viva situation, you should be able to answer it in a fluent way and know that level 5 is the worst level of evidence and level 1 is the best level of evidence. But in your theory paper, you should answer it with proper stratification with 1A, 1B, 1C, 2A, 2B, 2C, 3A, 3B, 4 and 5. And as a source, you can cite Oxford Center for Evidence-Based Medicine. So let's look at that. Level 1A is systematic review of well-designed, well-conducted randomized controlled trials. Now you might think the term well-designed, well-conducted is just occupying space in my brain, which is making it so difficult for me to remember. But you need to remember well-designed, well-conducted because The quality of the research that you are reviewing decides the level of evidence of the review. If you are reviewing poor quality research, then even if you have reviewed many such research articles, many such studies, the quality of the review, the level of evidence that you ultimately get from that review is not high. So you have to mention that you have systematically reviewed or meta-analyzed well-conducted, well-designed randomized control trials to get level 1A evidence. Level 1B is evidence from a single, well-conducted, well-designed randomized control study. Level 1C is all or none cohort study. What is an all or none cohort study? This is very commonly done in clinical trials when you are using a drug to understand whether it is having a therapeutic effect for a particular disease or not. And you see that all the patients enrolled in the study either show complete relief or they show absolutely no response to the administration of the therapy. That is all or none. Either there is complete relief or there is no improvement at all. There is no graded response. This is an all or none study, which is level 1C. Now let's move on to level 2A. Level 2A is evidence obtained from a systematic review of well-conducted cohort studies. Level 2B is evidence obtained from a single well-conducted cohort study as well as a poorly conducted randomized control trial. So a well-conducted, well-designed cohort study is equivalent to a poorly designed or poorly conducted randomized control trial or a randomized control trial with a higher confidence interval. That is level 2B. Level 2C is outcomes research or ecological study. What is outcomes research or ecological study? It is the study of the effect of exposure to risk factors on a large population. It is not the study on individuals, it is the study on a population. So there is ecological study, which is level 2C in the level of evidence chart. Level 3A is systematic review of case control studies. Level 3B is evidence from an individual case control study. Level 4 is case series or a poorly designed case control study. Level 5 is expert opinion from a respected authority and also physiological principles, bench research or first principles. What is bench research? It is research done in a laboratory. First principles, the basic thoughts that we have. For example, if you go back to the UFO theory, we can believe that because the universe is so vast, it is quite likely that there is intelligent life in a different part of the universe which has figured out intergalactic space travel, and that's why we were able to see the unidentified flying object.